Celebrating our 50th year. We're actually celebrating our 50th year, which is really exciting. It's hard to believe we've been helping North Dakotans for 50 years, but it's so fantastic. Um, we are basically a nonprofit, a private nonprofit. We consider ourselves a charity, and we help people with a wide range of disabilities. It can be a mental disability, it can be a physical disability, and then we help people with chronic medical diagnoses, such as muscular dystrophy, or diabetes or hypertension or things of that nature. There's so many to mention. Um, but we have a lot of different services that we provide through our financial assistance program. So I will get into that in a moment. But our mission has been and is always enhance the quality of lives of individuals facing health challenges. So there's some great pictures along our slides. This one in particular is a skiing event that we host. I'll talk about that in a little bit. It's for adaptive skiing. That's coming up in June. Pretty excited about that. So how we started was really around a kitchen table, to be honest. It was a group of parents and family members sitting around and talking about loved ones or children that they had with disabilities, and they weren't able to find the services that that person needed. They were kind of falling through the cracks of the system. And it just came about as, well, you know what? Let's start our own nonprofit. Let's see if there's more people out there that we can help. And that's really how it started. And it's just grown and grown and grown. So the founders of it are Ray and Faye Gibbons, based on their son, Michael. Michael was born cerebral palsy, and that's how it all came to be. Faye and Ron have since passed away. And we do honor their memory, and I'll talk about that in a bit. Um, so like I said, it was people that were ineligible for assistance programs, people that made $50 more a month and couldn't be on Medicaid, right? Still in that poverty line. What are you going to do? So they were going without prescription drugs. Maybe they were living without the equipment that they needed. So that was really important for our mission, was to help those folks. So we have 6 offices around the state of North Dakota, which is really exciting, I think, because when I started here 9 years ago, we had 3. So we've really doubled our capacity, and it just means that we're closer to the clients, making it more convenient for them. So Grand Forks is our main office. That's where we've been all these years. And then we have Fargo, which I'm in. We have Bismarck, Minot, Dickinson, and Williston. And Dickinson is our newest. It hasn't even been a year yet since we've opened. So really awesome that we're here to help everybody around the state. Well, one thing I do want to mention is, because we are on a border of Minnesota, when you have a main office in Grand Forks and you have a satellite office in Fargo, we do help people that live on the border of Minnesota. So someone calls and asks for services in East Grand Forks, Moorhead, or Breckenridge. Yes, we do help our friends across the river. So with our direct financial assistance program, we provide those funds for prescription medications, medical equipment that is prescribed by someone's doctor, or medical supplies. And there's a wide variety of types, from people that have incontinence issues to people that have diabetes and they need test strips to test their blood. There's a wide variety that we do. We also have a free healthcare equipment loan program. So that is a great service that's available in all of our 6 offices, where people can come in and borrow durable medical equipment, and for up to 3 months at no charge. And I'll get into that in just a little bit more. We have our North Dakota Organ Transplant Fund. A lot of times people call and they don't even know where to get help. And they'll call here and say, I just found your phone number. Maybe you can't help me, but And then it's our job to find a resource for them. That's our goal, is that we do not get off the phone with somebody until we can give them a resource to help them. We do help people on the spectrum. So we have an autism spectrum assistance program. We help a lot of folks that have to travel great distances to get care because they can't be treated locally. We have accessible vans that people can borrow for free. We help with paratransit. We also help with community fundraisers. That's been something that's been going on for years and years and years, and I think a lot of people don't know that about us. So I'll get into all of those in just a little bit. So here's the direct financial assistance program. This is why people contact us. It is because they don't have the money to pay for something. And even being on a government assistance program like Medicaid, that doesn't mean you don't have a copay of some kind. So this is why we're here. So you can apply. We have a short application. People can go on our website, they can get it off of there, they can call any one of our offices and we'd be happy to email it or mail it to you. But you do need to qualify. We do have some guidelines. One of the things that's great about us is since we are a private nonprofit and we do not receive any state or federal dollars, we have to raise our own money. Our guidelines are our own. And one of the great things is we're not like Medicaid, or say, for example, someone applies and they're just over the income limit, so they're denied. That's not how our program works. We don't automatically deny people because we have a set income limit. So these are some of the things we do not do. So if someone applied and asked us to pay a hospital bill from a year ago, that's not our focus. Dental and vision expenses, also not in our guidelines. We unfortunately can't provide emergency assistance because there's no way for us to do something quickly. When we provide that financial piece, it's paying the vendor. So if we're paying the pharmacy, it's going to come after the fact. So we can't provide emergency assistance. We don't help with premiums or like Medicaid recipient liability. We're not allowed to do that. And there's some other things, of course, nothing that's has to be related to a disability or a medical need. And like I said, we don't reimburse for medical bills, but we may have resources for the folks that ask us for these things. One of the things for financial assistance is adaptive rec. We really believe in physical activity for people with disabilities. Get out there and do as much as you possibly can. So people can apply to us and ask for the funding to do a session of maybe adaptive swimming lessons or sled hockey, adaptive bowling, there's adaptive taekwondo, there's wheelchair basketball. So that's a really great thing. And it can be any age. It can be a child all the way up to an adult. Durable medical equipment. So people will apply to us and ask us to pay for a walker or, a shower chair, a wheelchair. We've helped pay for power wheelchairs for people, power scooters. This is all, when they can't get any help from any other place, like Medicaid denies them, their insurance denies them. So we do pay for quite a bit of medical equipment for folks. Home modification. If someone needs grab bars or installed into their home, we pay for the grab bars and the labor, but we don't provide the labor itself. We leave that up to the client. If I received an application today for a person that is in a wheelchair full time and needs a ramp put on their home, that is something that we might be able to do. But we leave it up to the applicant to get those bids, to find their own contractors. We leave that up to them as well. We don't make them go to a certain entity for those things. And then medical supplies, like I said, anything like diabetic sensors. Those are very, very popular, and they can get really expensive even if you have insurance. So I have quite a few folks that use like the Dexcom sensors or the Freestyle Libre sensors, and they go and fill them, and the pharmacy bill comes to me, and we pay the pharmacy. So it's a really great thing. Um, I do have several folks on incontinence supplies, um, anywhere from age of 20 into their 80s. And what we do then is we order them and I have them shipped directly to their home. So it's nice and convenient for them. Out of town medical travel. Um, you know, we're we're pretty lucky in Fargo. We have a really great big hospital, Sanford, level one trauma center. We have a Sanford Children's. There are a lot of folks in North Dakota, especially in the rural areas, that have to travel to Fargo or even beyond. They have to go to Minneapolis or they have to go to Rochester and they have to go to Mayo. Well, insurance, most of the time, if you have like private insurance and sometimes even Medicaid and Medicaid expansion, they're not going to provide the travel piece like a gas card. Sometimes Medicaid may pay for a bus ticket or a train ticket, but our focus through our program is to provide a gas card. So, and it's a unique amount actually. What we do is we look at where do they live. So if you can imagine a person living in Williston, North Dakota, having to travel all the way across the state of North Dakota and all the way to Rochester, Minnesota, that is a long, long trip and probably a lot of gas. So what we do is we calculate the round trip miles and by the current IRS medical mileage rate. So it becomes a very unique amount to them. And we're really hoping that that covers all of it. We do help pay for lodging. So of course, you're going to travel to Rochester and maybe you have to stay a few days depending upon your procedure. We do that as well. We can pay up to so much per night, up to 4 nights per monthly appointment. So there are people that have to go to Rochester maybe this month, and maybe they have to go the next month because they can't be treated locally. That's something that we will look at for each appointment date. Paratransit. So if you have paratransit in your community and you come across folks that can't pay the fees, have them apply. So here in Fargo, we have MAP Paratransit. I know in Grand Forks, they have Dial a Ride. I think in Bismarck, it's Bisman Transit. So folks can apply to us and we will help pay for those monthly fees. And of course, each city is different, so it depends upon the fee structure. But it can be someone with a cognitive disability, a physical disability. I do have some clients with TBIs that are not able to use the regular city bus. They cannot navigate it on their own. So they're using MAP Paratransit, and then we help pay for those fees for them. You can use this for anything. It doesn't have to be medical related. If you want to go to the grocery store, if you want to go visit, if you want to go meet someone at a restaurant and use MAP Paratransit, or Dial a Ride or Bisman Transit, you can use that for that service, for that entity. Okay, personal attendant care respite. So we also pay the wage of the personal attendant care worker or the respite worker. So for example, I recently received an application from parents that have a kiddo on the autism spectrum, and they're looking for respite services. They're denied for everything, Medicaid, you name it. And they came to us and they just said, we just need a break. We love our child, but we need a break. So we were able to help them pay the wage of the respite worker. So works out really, really great, giving them that little bit of a break. Maybe getting out of the house to go to um, grocery shopping or just go for a walk around the block. Personal attendant care, our focus is your basic ADL. So what I mean by activities of daily living is that is for a person that has a disability where they cannot toilet themselves, they cannot dress themselves, That's where the personal attendant care worker will come into that person's home and provide those services. So, it really depends upon what the client needs. Of course, we're always in communication with every applicant's doctor, medical team, looking at what is medically necessary for that client. Prescription assistance. So we get quite a few requests for prescription assistance because, as you can imagine, when you have um, a disability, when you have a health condition, there can be some medications involved. So we look at the chronic medications, the chronic diagnoses. These are medications people have to take lifelong, they have to take on a daily basis, and they can't afford them. So you can be on Medicaid, you can be on Medicare, you can be on private insurance and still not be able to afford your copay. And that's what happens to a lot of folks. I think, and I do have quite a few clients that have TBIs that take medication, and we help them pay those copays. And they just go fill their medications. So once they're approved, let me back up. Once they're approved, we give them a list of the medications we're going to pay for. We don't pay for everything. Like I said, we focus on those chronic medications. So we don't pay for 10 days supplies of antibiotics. Our board of directors um, does not want us to pay for or does not approve payment of weight loss medications or smoking cessation. But the list of what we don't do is really short compared to the ones that we do. And I always invite people, especially providers, give me a call. You can call or give any one of us a call at any one of our offices and say, do you pay for this type of medication? Because if you don't, I'm not going to go through with the application process, or you can shoot us an email. Um, so we do quite a bit, like I said, of diabetes, hypertension, high cholesterol. There's just so many. And it can be one medication, it can be 20 medications. We do have a budget that we need to adhere to per month. So right now it's up to $700 per month per client. So I think that's pretty generous. Because people are dealing with high deductibles, and some of those medications can be hundreds of dollars. And people have told me stories. They're skipping them. They're skipping their meds. They're rationing their insulin. This is devastating, very dire to your health. We don't want that. That's why we have this program. Vehicle accessibility. So we do fund adaptations to vehicles, not just vans. Like, this is a picture of a van. It can be like an SUV. So if you need a lift on your vehicle and you can't afford it, you can apply to us. Last year, we put hand controls in a gentleman's pickup that had muscular dystrophy and spinosis. So just so he could be independent and drive his own vehicle. And what a blessing, right? So he could just get in that vehicle and go wherever he wanted to go and not have to rely on someone else. So that was exciting. So this is a great opportunity for people that are in wheelchairs, but they just can't go from A to B just because they don't have an accessible vehicle. We might be able to help with that. Autism spectrum assistance. So through the direct financial assistance program, we kind of offshooted into the autism spectrum assistance program. Did this back in 2020 and really focusing on, it can be children or adults on the spectrum where they're living in a rural area and they have to travel a ways to go to therapy. So, for example, I have a family that lives about 30 minutes out of Fargo and has to travel 3 to 4 times a week into Fargo. As you can imagine, that's a lot of fuel. That can get, pretty pricey. And when you're a single parent and you're trying to work, that can be pretty difficult. So right now we're providing a gas card um, for speech therapy, occupational therapy, and behavioral health. And so those are that's what we focus on is the therapy piece. Or even if you have to come in and get tested, go to a big city and come and get tested for autism. That might be something we can do. We do help with respite services. That's where that comes into play as far as, you know, parents just needing a break. We can help with that. Also, equipment. If there's some maybe a safety item that maybe your child or your adult child um, wanders, runs, and you need maybe some alarms on your doors. That might be something we can help with. Weighted blankets, weighted vests, um, those nature of that. So it's really a lot of things that you just can't get through your insurance. Um, and there's some unique items out there for individuals on the spectrum, and they're greatly needed, like for sensory integration and such, and they're not cheap. So this is another opportunity that we may be able to help. So here's the healthcare equipment loan program. It's such a great service to the 6 communities that we serve, and out of towners can come in as well. So, for example, in Fargo is where I am. My service area is 10 counties in the southeastern portion of the state. And if you go to our website, ndad.org, and you click on request assistance, it's going to pull up this really nice, colorful map, county map of North Dakota. And you take your mouse and you hover over what county you live in, and it'll pull up the application for you, but it shows you which office, what region we have. But it's not that you can't call any office. We'll help you no matter where you are. So 6 offices have this program, and you can come and you can borrow up to the 3 months or 90 days durable medical equipment. We don't have a maximum. If you need 8 pieces, you can come in. So these are folks that have a planned surgery or they've been injured. They were in a car accident and they're in the emergency room and they're going to be admitted and they get discharged in a couple weeks. And here comes the physical therapist and says, you can't leave without medical equipment to recover at home. And a lot of times insurance is not going to cover equipment for short-term purposes. So that's why we started this program all these years ago. It's been running in the Grand Forks office for over 25 years. Come borrow it from us so you don't have to pay for it, right? If you're going to recover or you need a little bit of time to find an alternate plan, if you're applying to NDED for the equipment or your insurance is going to pay for something, but it's going to take 2 to 3 months, this is a great option for you. You can try out medical equipment before you buy it if needed. So we have anything from sock aids and canes and there's a picture of a knee walker, which is very popular for people that have injuries to their ankles or sprain their ankles, break their ankles. You can use a knee walker instead of crutches. So each office, we try to have a large variety, large quantity on hand for you so we don't have to turn people away. We recently moved in our Fargo office to a space that is 3 to 4 times the size of where we came from. And really what that means is we get to add more and more equipment to help more and more people. So it's really a great thing. We do have power equipment. Each office should have some power wheelchairs and some power scooters. The difference between the power equipment and the regular manual equipment is that we do need a prescription from the doctor, just saying this this person needs a power wheelchair, it's medically necessary, this is their diagnosis, and they can operate it independently. So you can also go to our website. We give a really nice list of here it is, actually. Sorry, I didn't think it was on here. But this is kind of gives you a snapshot of what we do. Commodes and lots of bathroom safety items. That's kind of like the number one thing why people come in. They're looking for a shower chair. They're looking for a toilet riser. They're looking for something that they can hold on to when they're getting in and out of the bathtub. crutches, canes, bed rails, because you can't get out of bed on your own, even portable ramps. I did have a veteran not that long ago, was in a terrible, terrible car accident. And the VA was going to provide medical equipment for him, but he had to wait weeks to months. So he called us up and we loaned him a manual wheelchair for him and a portable wheelchair ramp that basically just sits on top of your steps that goes into your main door of your home. And then once the VA was able to give him his medical equipment before the 3 months, and then he just brought ours back. So there's all kinds of different stories to tell, but it really is a great program because, we're recycling, which is great for the earth, and you don't have to pay for it. So here's our accessible vans. So Minot, Grand Forks, and our Fargo office each have two accessible vans. We recently got them, so we've only had them for about 2 months. Um, People can call us, and if they want to reserve the van and it's available, you can. Here's the conditions. So the driver must obviously have a current driver's license, current form of vehicle insurance, and the client needs to be a full-time wheelchair user. So I have a gentleman that called the other day, and he wants to borrow one of our vans on Friday. He wants to drive up to Mayville, which is kind of on your way to Grand Forks, and he wants to take his friend out for lunch. And his friend is in a wheelchair, and there wouldn't be any other way to do it. We'll borrow ours. So he'll come in and he'll fill out a form. There is a loan agreement to sign, of course, and just give me his driver's license, copy of his driver's license, and his vehicle insurance. We don't charge for it. We do not charge like a rental fee per day or per mile. All we ask is that when you return it to us, you've got 2 days per month. You can borrow it. So if this gentleman called next month and he wanted to borrow it and it was free, he can do that as well. Just return it with a full tank of gas. Otherwise, we don't. There's no. Like I said, we don't charge a fee for it. So really great. So there's 6 vehicles now around the state that we have that for. Yeah. So spread the word about that. It's a great. I mean, if you say, for example, you have someone that just wants to go to a family reunion or a wedding or a baseball game, and that person in the wheelchair can't get from home to the destination, this is an option. We do, and one thing I wanted to mention is we do allow the vans to go outside of North Dakota. So, for example, if a person needed to go to Minneapolis for a medical appointment, we will work with that as well. We just need verification of the medical appointment. We can only do up to 2 days. We really just wanted to be fair for people, and the vans are always going out, which is a wonderful thing. So, for those of you that don't know, the state of North Dakota has something called an organ transplant fund. It's a program, and it's been around for decades. Actually, it was, sorry about that. It was started in 1991 it was a bill that was passed by our North Dakota legislatures, and it's a pot of money that helps people that are going through a transplant. It can be a person that is giving the tissue or the organ or receiving the tissue or the organ. And so we've been doing this since 1991. So where our involvement comes in is people can apply to us through the direct financial assistance program. And if it's transplant related, they've had the transplant, those expenses come out of this fund. And the money comes from a collection of North Dakota taxpayers that that will get less than $5 as a refund on their tax return. And I actually have a funny story about that. It was several years ago, but I didn't know about this fund before I worked for NDAD, and I was supposed to get like $3 and some cents back from my tax on my tax return. Never got it, never got it. And I thought, well, that's kind of weird. So I called the 1-800 and I found a 1-800 number and I called and I said, I mean, it's not a big deal, but am I going to get that refund? And the lady on the other end said, no. And then she told me about this. And I said, that's okay then. Right. So anything less than $5 goes into this pool of money to help folks going through a transplant or operation. So what this allows us to do is, because it's not NDAD money that we have to raise, sometimes we're able to go a little bit above and beyond what our regular budget is to help people. Maybe there's a medication that's a little bit more money. Maybe they have to stay. Uh, when you're going through a transplant, it's you have to stay at that hospital to be observed for weeks to sometimes a couple of months. I know with the heart transplant, it's up to 90 days minimum. That's a lot of money for a hotel. And this fund can help with that. Um, there was a gentleman several years ago, he got a new liver. He was in his 60s and he had to stay in Minneapolis for a minimum of 6 weeks. So the hospital set him up in these apartments. Well, that's a lot of rent. So we were able to help them pay the rent for 6 weeks through this fund. I think it's underutilized. It's never run out of money and I hope it never does. So I'm always spreading the word about this wonderful, wonderful program. So if you actually go to your computer and you Google North Dakota Organ Transplant Fund, NDED is going to pop up because we are the custodian of the funds. Community fundraisers. So we want to help folks out there that need to raise money to pay their medical bills. As you can imagine, anybody going through a devastating diagnosis, they can rack up medical bills really, really fast. And that, even if you have insurance doesn't pay for everything. So what we do as our part of helping people with community fundraisers, we are we are the funding piece. So when people, so I'm going to give you an example. I work better that way. So say, for example, I have a friend and this friend is going through a lot and the medical bills have piled up and I'm going to help put on a spaghetti supper and a silent auction for my friend. I'm going to go to NDED and I'm going to ask them to help me. So their piece is this. So when I go to that spaghetti supper and I donate $25 or $50, I'm actually donating it to NDAD. And where that becomes important is that we are a nonprofit. And so people can use it as a tax deduction off of their taxes. Or if my friend is receiving food stamps like SNAP, my friend is on Medicaid or other government assistance programs, these donations are not going to count against her because they're not being donated directly to her. So it's not going to count against her income. And what we do is we set up a bank account for that person and we pay their bills through that fund. And the fund can be a few months, it can be a few years, but we don't charge a fee for it. So we do this for free. We track the funds raised. Like I said, we pay the approved bills. And what I mean by approved bills is we always meet with the fundraising committee and we talk to the chair of the committee and we lay out a plan of what bills are going to be paid before the fundraiser happens. They can be, unfortunately, funeral expenses, or like I said, those pre-existing bills, therapy dogs, all kinds of things. So like I said, we just keep track of the money and we help the folks out. I think when you're going through anything like this and you a health issue, that's emotional enough. And then you've got this other side of it with this financial burden. It's enough to drive you, you know, it's just so much, it's so much stress. So maybe we can take a little bit of that away from you. Um, so we do not actually put the fundraiser on itself, but we will meet with the fundraising committee. We go to the fundraisers. Our marketing team up in our Grand Forks office will print all your marketing materials for you. Your brochures or your flyers. We'll put it on our social media on Facebook, X, really get the word out to help you. And then also what we've added a few years ago was we're able to, with our funding, do a match up to $3,000. So that is a great incentive as well. And if you ever have a question, you can call any one of our offices and we'll walk you through this process. We have a nice little packet that we can give people that talks about the community fundraising program. I touched briefly on people calling us because they don't even know where to begin. You know, several phone calls in the last few months, and I don't know why, of parents very emotional saying, I just left my child's doctor's office and my child has autism. What am I going to do? You know, it's kind of up to each one of our offices in our communities to know what our community resources are. So we can talk to that person on the other end and refer them, even if it's something we don't do. So our client reps in our offices are very active in community committees, sharing information about NDAD and then gathering information. So we get calls for housing. I'm being evicted. I got a shut off notice for my electricity. We have a list of resources that we can refer to people to. So I think there's some statistics along the way here of what we've done last year. It's pretty amazing. Just word of mouth, just sharing ideas with people. I mean, that's really how we help each other, is brainstorming ideas. Last month, we sent out notification that we were providing a grant opportunity. So that's another thing that we do. So NDED actually has a grant application process. One of the grants is called Adaptive Rec. And then the next one that I'm going to talk about is the Gibbons Memorial grant after our founders. So last month was the cycle for the Adaptive Recreational Grant. So a nonprofit that's in North Dakota or our friends across the river could apply for funds to provide some type of adaptive recreational activity. Here's a picture of something we funded in Minot to provide accessible playground equipment. But we get so many different grants, and it's just wonderful what nonprofits want to provide out there for people looking for adaptive activities to do. But they're not there in their community, but they want to start them. So they need that seed money to start. So we're able to give a $5,000 grant to nonprofits. And then the next one is the Gibbons Memorial Grant after Ron and Faye. That is going this month, actually. It's running from April 1st to April 30th. The grant application is actually on our website, or you can email one of us and we'd be happy to get it to you. Very vague. It can be a wide range of different nonprofits, but it's organizations that help people with their health, their welfare, a social service agency or educational purpose for at-risk populations. Well, at-risk can be anything from homelessness to people with disabilities. So great programs out there. People are doing tremendous work, but they just need a little bit of funding. This too is a $5,000 grant. And depending upon our funding, sometimes we can do more than one. Last year we did our most. And I think we did up to $100,000 last year for folks between the two grant cycles. So this is one of the funnest things that we do for people is we hold an adaptive water ski event every year, minus COVID. Of course, I think everything shut down during COVID, but it's called Escape to the Lake. And it is completely free to the participants and their families. Caregivers can come. We don't charge anything. And it is water skiing on sit skis. And we all meet at Nelson Lake, which is about 30 to 40 miles outside of Mandan, North Dakota. It's so centrally located in the state. It is the only lake in the state of North Dakota with warm water because it's sitting right next to a power plant. So it's really great if it's a cold June morning, right? You can get into the water and it's warm, like a bath water. We hire we hire like a ski team, and they fit the skis to the participant, and they can go ride around the lake. We spot them with jet skis and a boat, and make sure that everything is safe. We also provide, along with another nonprofit that collaborates with us, they bring out a pontoon boat. So there's a picture here. People can take pontoon rides. But what I've noticed in all these years that we've been doing it, families bring out their campers, their tents, and they go fishing and they go swimming and they make a day of it. So this year it is on June 21st. It's usually on a Saturday in June. And if you have anyone that is anyone with a physical disability that is interested in participating in this, even if you just want to go on the pontoon and you don't want to ski, or you want to ski and you don't want to go on the pontoon, contact me. I have the registration forms, and I can send it out to you. They are due, I think, on April 28th. We need that deadline to take all of the registration forms and make sure that we put people into the ski spots that they need to be. So we have morning skiers and we have afternoon skiers. We provide a free lunch for everybody. And while everyone's eating, we put Aqua Addicts out of Aberdeen, South Dakota. They put on this really fun ski show for everybody, and they do the pyramid. It's a lot of fun. So yeah, give me a call or email, and I'd be happy to get one of the forms out to you. You can be anywhere in North Dakota. It doesn't have to be near Bismarck, and we get folks coming from Fargo, Grand Forks, Williston. We do have an option where if gas or lodging may prohibit you from attending, you can apply through our direct financial assistance program, excuse me. And if you're approved, we can provide that gas card and hotel assistance for you. So it's really a great, great event. There's usually about 150 of us out there for the day.
Kim, I just got some questions in the chat.
Yeah, go ahead.
Do you have a flyer on the event?
The flyer should be on our website. If you would like a colored flyer mailed to you, you can contact me and I will get one to you.
Okay, thanks.
As well. Okay.
And what was the date of that again?
Okay, so it's going to be Saturday, June 21st. Oh, one thing I did want to mention while you brought that up, thank you, is we're outside, right? So we've had to cancel this because of rain and lightning storms, high winds. But if the weather isn't safe for skiing or pontoon rides on that Saturday, we will do it the next day on Sunday, if weather permitting. So we kind of block out that whole weekend to try to hold the event.
Perfect, thank you. I did attach the link to Escape to the Lake from the website into the chat if anybody wants to look into that anymore.
That's wonderful. Thank you so much. So last year, this is kind of us just kind of grouping everything, and with we were able to, pay for little over 6,000 prescriptions. And, through the HELP program, we loaned out about 5,400 pieces of medical equipment to almost 3,000 people around the state. And our friends across the river. So as you can imagine, our Grand Forks and our Fargo offices are busy with this program, helping people in Moorhead, helping people in East Grand Forks. So we want to include those folks as well. Our vans went out to 126 individuals for 246 trips. Look at a little over 300 pieces of medical equipment we purchased, 567 medical supplies. Over 2,000 trips were funded with gas cards or lodging. 8,000 accessible rides. So that's that paratransit piece. The grants that we loaned or we provided $100,000 for those. Over $4,000 in personal attendant care and respite care was funded. So, and over 50,000 interactions. So yeah, we get a lot of those emails and phone calls of what else is out there. And the countless relationships. I mean, I have clients that we've been helping for decades and decades. They applied, they requalified. As you can imagine, we've gotten to know them pretty well. Let's see. So here's where you can find us, ndad.org. That's where you can find all of our brochures. We have one agency brochure, and then we have what's called a rack card that if you're looking for something more specific, like just the prescription assistance piece, or you're wanting to know more about transportation, we have those also. You can sign up for our e-newsletter. It's digital. It goes out every quarter. We highlight some client stories on there, anything that's new that's going on in our communities. And of course, you can find us on Facebook and X. We have a great social media manager that is really good at getting the word out about if we're going to be doing a presentation somewhere. So this presentation was announced on our Facebook page and X. Anything that's going on, it doesn't even have to be NDD related. If it's disability related, we just want to get the word out, we'll just do a public service announcement as well. Here's how to contact all of us. But this is also on our website, but we each have a general email box with our phone numbers here. Let's see. Now, is there any questions? And is there any other questions that I wasn't able to answer yet?
Kim, I got some questions from someone in the email that
Okay.
I'm just going to read. I think they might be watching the recording, so I told them I would.
Oh, I see. Okay. Okay.
So can you talk about how NDAD might be able to support someone unable to drive, but could potentially use public transportation if bus trained? Could NDAD help with an initial bus pass and costs for a bus trainer?
That is a really great question. We do not help with regular city bus services. Our focus is the paratransit piece because basically the disability that the person has prohibits them from using a regular city bus independently. So they need that service provider like Map Paratransit or Dial a Ride to go to their home and help them get on the van, where they need to be wheelchair accessible, and then take them back to their home and help them get back there. So no, we do not help with the regular city bus.
Okay, thank you. Next question. If a person is in rural part of North Dakota, could not get needed assessment locally, could NDAD potentially help with some transportation assistance, possibly mileage reimbursement, like I know you were talking about, and if needed, a night's accommodation to get evaluated in one of the cities?
Yes, possibly, yes. So obviously most rural people, they're going to have to drive to where they're going to go, whether it's Bismarck or Grand Forks or Fargo or beyond. So yes, possibly depending upon what type of appointment it is. We don't pay for everything like regular appointments. If you wanted to go, say you're living in Ellendale and you have to come to Fargo for your annual physical, that's not our focus. Our focus is those unique um, situations. But I would invite this person to contact one of our offices directly so we can answer their questions and get a little bit more information and then basically say, yes, we encourage you to apply, or no, we may not be able to do that. But yeah, so what we do is
Ever,
we
have you ever
go
had
ahead.
someone contact you? I'm just thinking about our world. Have you
Yes,
ever had someone
yes,
reach out about like neuropsych testing?
yes.
Okay. Okay.
Yes. And it does happen. We get people from Grand Forks that fill out our application up there, and there's nobody in Grand Forks to help them. They
Mhm.
have to go to Sanford Neuro down here in Fargo. That happens a lot.
Okay.
Someone, yeah. So that is a unique appointment. That is definitely a unique appointment.
Okay.
That's something that we would consider. And so we like to provide the gas card ahead of time,
Mhm.
right? So you can use it to get from A to B.
Sure.
Yeah. So absolutely. Very good question. Thank you.
Yes. And then the last question I have for my email, if no other options exist, could NDAD potentially help with home modifications or rent assistance?
Okay, so we do not help with rent assistance because it's not medically based. So our focus is strictly medical. So if you look at our application, it'll tell you we are focused on those medical items and services that people can't afford or get elsewhere. Um, and then tell me, can you repeat the first part of the question?
The if NDAD is able to help with home
Oh,
modification.
yes, yes. So right, so some of the things that we have done with home modification is someone needs a wheelchair ramp put in their home. So we will look at the main door of the home. We can only do one ramp per home. Part of the criteria is the person that's applying has to own their home. And reason being is if we would pay for a ramp and put it on rental property, it does not belong to the client. It belongs to the person that owns the property. So if the client gets evicted or the client chooses to move, they cannot take that ramp with them because it doesn't belong to them. So that is one of the criteria. Of course, budget. We have to look at that as well, but we know that they're costly. We know that. And of course, it has to be permanent. So we're not going to provide something that's temporary and then take it away. So yes, we've helped with, like I said, it depends upon your diagnosis. So say you have quadriplegia, and you need some type of your bathroom modified to fit your needs. We will look at that as well. So it's really we take each application as it comes. Everyone has a unique situation, and yeah, but we do help with home modifications.
Great, thank you.
Yeah.
I had a question, Kim. When you talked
Yes.
about the good job, by the way.
Oh,
Thank you.
thank you.
Um, as far as the rental equipment, um,
Hmm.
um, if if you're in the hospital, and you're needing like for instance the any type of equipment, is that is that is that something that we just we call you or the doctor calls you right away and they bring you the equipment to the hospital or how does that work?
That's a great question. That's a great question. So, um, we do not have the resources to bring the equipment to the person. but we really do our best to make it work no matter, I mean, just make it work with, could somebody else come and pick it up? We have yeah, in the past, it's been a unique situation, and I can't speak on the patient's behalf, but Sanford's delivery service was able to come and pick some equipment. Um, so, right, we do not have the ability to actually deliver to to the hospital. We don't have the ability to, when it's due back, to drive to your home and bring it back. But maybe we can come up with some ideas. If you have a neighbor, if you have a family member that, that can do that. We've come across some really unique situations to try to get the equipment to the person. Um, and so it is, one of the things I wanted to bring up, there is like a form you fill out, but we're able to do things like fax it to the hospital. We've emailed it to the physical therapist. We email it to the patient. And there's all kinds of ways technology wise to get them what they need. Did I answer your question?
Well, my understanding though is it's the medical equipment is in your facility. Is that right?
Right,
Okay.
right. Each one of our offices. So, right. So I have rooms that have medical equipment within them, and people can just walk in and say, can I borrow a shower chair? I'm having surgery next week. If I have a shower chair, you can borrow it. Yeah, so we get a lot of calls from physical therapists, from the hospitals, Sanford, Essentia, CHI, all true, asking, do you have, such and such for this patient? If we do, we're going to pull it aside for that person, hold it for a couple of days until they can get, they can come and get it somehow. Yeah. So I mean, and as far as I know in Fargo, I don't know of any other free loan program. Maybe some of the churches do, but it is a unique program to most of the communities we serve. And we try, like I said, we try our best not to run out of anything. So we have to turn people away. Otherwise, your options are going to like a durable medical equipment store and paying a fee to rent or buy it. So, yeah. Anything else?
I had a question. I put it in the chat. I'm the
Okay.
co-director of special education for South Valley and rural Cass. I have a
Yes.
question about like sharing and outreach for some of our families. So
Mm-hmm.
boundaries comes out, seasonally, but over the winter months, there's some of the families who can't afford to make multiple trips to Fargo for the medically based speech OT-PT services. Is that something that we can encourage those families who are struggling financially to transport their children to seek assistance with you guys for?
Yeah, possible. We do focus on autism. I mean, our focus is
And
autism.
those families, these children that I'm thinking of would, yes.
Yeah.
Get that.
As I can imagine living in a rural area, I'm guessing maybe the closest would be Wapaton, but that doesn't necessarily mean those services are going to be there either.
Yeah.
Yeah, if it's medically necessary and the closest place is Fargo, yeah, I would encourage those families to apply, because I checked with the state of North Dakota, because we have a North Dakota autism waiver.
Yep.
Even for families that are on that waiver, there's no transportation piece.
No. And so like we
Right.
actually, because I had one specific family I'm thinking of without sharing too much more information that
Mhm.
I was like, how come we haven't referred them to Southeast Human Services? They need help. The mom is crying out for help.
Yes.
And it's beyond, so we're providing the school-based things, but when Beyond Boundaries doesn't come out over the winter and the kids need those
Mhm.
services and ABA therapy, it's detrimental to them as a family. And for
Right.
personal reasons, the one parent can't work, and so they do have
Mhm.
for some assistance that way, and
I
our
come across that
can't help.
so many times where one parent isn't working because they can't.
Yeah,
You
well,
know,
the needs
I
of the
have,
kids, I mean, they have to be available when their kids have,
Mhm.
needs. And then during the
Yes.
summer months too, I mean, they're with the children, they're the sole caretaker. And I'm just going, I could see them benefiting if they were eligible
Mhm.
for some access to some respite care
Yeah.
too. Yeah.
Yeah. One of the things, what we do is, we look at all of their appointments,
Hmm.
how many times they're traveling, what the mileage is, and we look at a month's time usually. And then we like to provide that a monthly gas card.
Okay.
So, and yes, I mean, if you can arrange your occupational therapy and your speech therapy on the same days in Fargo, great. That doesn't happen all the time. Or you're having behavioral health therapy at a Fargo facility. That might be on a completely different day.
Some
We
of our
all don't get
families
to pick.
travel. Yeah, they travel into
Yeah,
the
we don't get to pick when we
center.
want.
Hmm.
I would encourage the families to contact me. I'd be
It's
happy
another
to, I'd
resource.
be,
So even if you
yeah,
can't support them, and they're not eligible for Southeast Human Services, or there's some things above and beyond what Southeast Human Services can assist with, maybe you have some other
right.
resources too. I'm big on helping families who really need the help.
Absolutely.
Yeah.
Absolutely. Aren't we all, if we're
Yeah.
on this call, aren't we all in the helping profession? Absolutely. And there's just government programs that just miss the mark. I
Yep.
think
They're
it's
just
it's a
outside
matter
the
of us, all of
criteria.
us brainstorming, isn't it? It absolutely is. So yep, I encourage anybody to contact me. I'd be happy to talk to them.
I appreciate it. Thank you.
Yeah, you're welcome.
I have a question.
Yes.
Are there any restrictions or limits on a family or a person's income to qualify
Okay,
for
great.
different like to have a ramp built on your house?
Yeah, great question. So I did touch on the piece where we don't just automatically deny people based on their income. So how our program works is, so we're looking at federal poverty level. So if someone applies and we look at their income and their assets and it's over 225% federal poverty level, and we're looking at a scale. We're looking at an algorithm. I don't come up with this. And they'll have what's called a client contribution to meet. So, for example, if I get an application today and the applicant is at 250% federal poverty level, and their client contribution is $500, we're not saying you have to give us $500 before we'll help you. What we're going to say is, have you spent $500 in medical expenses in the year since you've applied? So we look back at the 12 months, and most people have. You can make a really good living, but so much of your living is spent on medical expenses, you have nothing left. And that's why we do it that way. So that's basically how we work around the whole income thing. Do you understand what that means? So did I answer your question?
Yeah, yep, I understand
Okay.
now. Yeah.
Yeah. Yeah.
Uh,
Um,
Basically, just give you a call and see if you
mhm.
qualify.
Yes, and we were able to, wonderful family I helped out in Napoleon, with a teenager, with TBI, but also physical disabilities, and they needed a special piece of medical equipment that was, I think, $25,000. Now we couldn't help with the $25,000, but we piecemealed it together. The dad and I, the dad did a great job of finding other grant options, and then we kind of came in at the end and kind of finished it off. So they were able to do it. And this family, he was a chiropractor, but boy, oh boy, that doesn't really matter when you have a kiddo with special needs. And you're paying a lot in medical bills every year. So that was one of the moments I was so proud of, that we were able to do that for them. So yes, if you have a question about the income piece, I think giving us a call, and there's certain questions we're going to ask you, to see if you should fill out the application or not.
Kim, you might already said this before, but does it matter what insurance you have, whether it's Medicaid, Medicare, um, in order to qualify
No,
for NDAD?
no, no. So, we have quite a few, I have quite a few clients that are, on Medicaid and we help them with prescriptions, but they still have copays. Or they're on Medicare Part D, which is the prescription drug coverage, and they have copays. So you do need to be insured. There are people that call us that have no insurance. I've been able to help people get on prescription assistance programs through the pharmaceutical companies. But it doesn't really matter the insurance piece. People have been on a military type of insurance, a private insurance, but like as you know, insurance is just insurance. It doesn't cover 100% all the time. And so if you're a person that's on Medicaid, and even if your medication copays are $2 a piece, but you've got 20 medications, that can add up to a lot for somebody living off of Social Security.
Yeah.
So maybe we can pay that $20 a month or $40 a month or what have you. I've had clients say to me, now I can, that's great. You can pay my pharmacy bill and now I can go pay for groceries, right? So there's all, like I said, there's all those kinds of unique situations and unique stories. So yes, and on our application, we will ask that. We have a space on our back page that asks you what type of insurance you do have.
Yeah.
I have another question.
Uh-huh.
Is there an organization or an outfit in the Fargo area that helps you, walk you through um, signing up for Medicare, all the different plans of
Mhm.
it and choices and things like that, and Social Security, signing up for that at 65?
Um,
Is there any organization that does that?
yeah. I'm not sure about the Medicare piece, but I do know that our Freedom Resource Centers do help people apply for Social Security disability insurance. I think that would be, I would definitely give them a call. We have one in Fargo. I think there's one in Wapaton, Lisbon. Um, Ask them if they would help you with the Medicare piece. During open enrollment, our Valley Senior Services helps people apply for that. Um, those are the only two that I know of. If anybody else that's on this call has any other ideas, please chime in. This would be a great time to help him.
Well, what was the name of that last one you said?
Okay,
Senior?
Valley
Yeah.
Senior Services.
Okay.
And they're in Fargo, so is Freedom Resource Center. But I just want to mention that they have offices in some rural areas as well for those rural folks.
I often tell my clients about the DCILs around the state, Dakota Center
Okay,
for
yes,
Learning.
yes, there. Thank
Um,
you.
DCIL is more so in Bismarck, Dickinson
Hmm.
area, but they're pretty similar to like the Freedom Resource Center in Fargo.
Yes, they are. Thank you for bringing that up. That's a wonderful resource. Yes, the independent living centers. Yes. Yeah. Anything else? Okay.
I don't
No.
know. I don't know if that's related, but what kind of what kind of worked really well with you, Kim, was the aging and disability services. Um,
Mm,
so they worked hand in hand with me, with you, Kim, with NDAD. So I think they're a huge resource, because they were amazing. So I think they are a huge resource for everyone. So I highly recommend. Um, aging.
Yes, Landa, you're right. Thank you I forgot about them. They're a great resource for people.
I think they're
Absolutely.
amazing. So I think NDAD and aging and disability services are hand in hand for people. So
Okay. Well, thank you. Thank you. Yeah, we try. Yeah, but yeah, absolutely. That's a wonderful resource as well. And they have so many resources on their website for all kinds of different diagnoses. So it's a wonderful, wonderful place to go. Well, I'm done. If and nobody has any other questions. This was just a treat for me. I love presenting about our services. So like I said, I welcome any emails, any phone calls, any questions that you might think of after the presentation is over. I'm here to help.
Thank you very much.
So much, Kim.
You're welcome.
bye bye.